right, well, it's 12 o'clock, so let's get started. Thank you everyone for joining our webinar today. Okay, this is CPHA's Infectious Disease and Climate Change series, so welcome. This is the second webinar that we're holding in our series that's going to explore current and emerging infectious disease and climate change topics to share knowledge, research, and best practices. So to learn more, you can visit cpha.ca. Before we begin, I want to acknowledge that the Canadian Public Health Association's office is situated on the ancestral and unceded territory of the Algonquin and Anishinaabe people. They have been the guardians of this land for millennia, and we are grateful for the example their stewardship provides. CPHA is committed to working with all First Nations, Inuit, and Métis peoples and their governments in realizing meaningful truth and reconciliation. We would also like to express our deepest gratitude to all the frontline essential workers dealing with the COVID-19 pandemic. Thank you for all your hard work in keeping us safe during this time. Today's webinar is Tick Surveillance Goes Online, Progress and Preliminary Results of the eTick program in Canada, is brought to you by the Canadian Public Health Association through the Infectious Disease and Climate Change Project. I'm Jillian Pritchard, Project Officer at CPHA, and I'll be the moderator for today's webinar. So just a quick housekeeping before we begin. It should be noted that all of our Zoom attendees are muted. And if you have any questions for the presenter, please type them into the Q&A box at any point during the webinar. All of the questions will be answered in sequence at the end of the presentation. Only you, myself, and our presenter can see the My Questions section, and there's also the option to submit these anonymously. If you have any questions regarding technical difficulties, please also ask them in the Q&A box and we'll reply as soon as we can. And if multiple people are experiencing the same problem, we will address it live. Just a few points before we begin. This webinar is being recorded and will be made available on the CPHA's YouTube channel a few days after the presentation. And we'd also really love to get your feedback. This is only the second webinar in our series, but we're hoping to hold a lot more. So it would be really helpful to get your comments on what you found valuable about this and ideas for next webinars. So after this webinar, a survey will pop up and we'd really appreciate it if you could fill that out. And finally, CPHA are holding an Infectious Disease and Climate Change Forum on October 5th of this year. And you can visit our website for more details. Now I'd like to introduce our speaker for today, Dr. Jade Savage from Bishop's University. Dr. Savage is a full professor at Bishop's University in Sherbrooke, Quebec, where she has been teaching and conducting research in the field of entomology since 2004. An important part of her research program is dedicated to the development and dissemination of arthropod identification tools accessible to non-experts, especially for groups of medical or agricultural relevance. She is the instigator of the eTick project, a citizen science tick monitoring tool and information dissemination platform in Canada. And with that, I would like to turn it over to our speaker. You can now start sharing your slides.
Hi, everyone. Nice to be here. Is this looking good? Okay. Perfect, thank you. Welcome. I don't know how many of you have seen some of this information before. And what I want to do today is really sort of cover it all. So to give you a little bit of the overview of the development of the project. So not just where we're at today, but how did this all sort of happen? And then, of course, I'll go through some of the data that we've collected. We're a young platform, and so don't expect any fancy analysis. I'll be really into descriptive information to give you really a topo of what we've been gathering, and hopefully over the next few years, we'll have enough data to start looking into patterns. Once I cover some of that information, I'll discuss a little bit some of the challenges that we've encountered, some of which we still encounter with the project. If I do have time, then we can go through a live demo. And I've also mentioned that at least I am quite comfortable with interruptions, either during the presentation, during the live demo, or it can wait for the question period. But if Jillian is willing to monitor the Q&A and agitate yourself as we go through. I'll be happy to take your questions as they come in. So don't hesitate. It doesn't have to wait just for the end. So basically here, I don't think I need to provide too much information as to why we need to, well, why we need to monitor ticks. I think that is pretty obvious, but why is it that it was felt that there needed to be a way to change the way we monitor populations of ticks in Canada? Primarily what I'm calling passive surveillance here. So there are definitely different ways to monitor ticks. Here I'm really talking more about what to do with the ticks found by people on themselves or their pets in a continuous and general manner. So many of you know that different species of ticks in recent years have either expanded their distribution ranges or are now more abundant. Many of the diagnostic labs, usually at the provincial level, across the countries are now drowning in ticks, whereby 15, 20 years ago, they wouldn't get so many. So definitely an increase in the volume of material that needs to be handled. And well, this always translates into a limitation in terms of human resources, but also a limitation in terms of how we handle these submissions. So using the postal system, forms, it can get very heavy. And it also means that people who find ticks may not be able to get an identification and some general idea of the implications of having found that tick for several weeks. So this is what somehow sort of motivated me to start looking into a way to change the way passive surveillance can be done. And so what we developed through eTick was really trying to come up with a rapid identification process. So here we'll be talking about image-based identification through an online platform. So this is one part, but we were also hoping to be able to return the information equally fast to the people that submitted their ticks. And so taking advantage of the web to do that, but also taking advantage of a number of either crowdsourcing or citizen science projects such as eBird, eButterfly, all of these platforms that have been developing over the last decade and that have shown that it can actually be done. There's a lot we can do with image-based identification. And as you'll see in a bit, back in 2014, I figured why not giving this a shot for ticks. So the possibility of increasing the flow of information exchange was my first goal. Then, of course, having the capacity to increase engagement. So in different provinces, there are different channels and different ways to get information about a tick you found. Some provinces have very little resources, others have a lot. And what we wanted was to be able to provide every individual with information about the tick they found, but also quick information about what to do based on their province of residence and the species that was discovered. So it's a bit of an exchange. You give us a dot on our map so we can know what tick was found. And in return, we provide some very quick information about the species and its medical relevance. So for us, this was a win-win situation on how to engage the public, but also making sure we give them the proper information at a time when they're the most receptive, because we don't find ticks every day. Well, it depends where you live, but most people don't find ticks every day, and therefore they often don't think about it until they do find a tick, and then they would like to get information rapidly, but they will also retain that information better than if they're just browsing online for general information. The final objective for the eTick project was to try and figure out a way to, I wouldn't say standardize, but at least get a uniform way of gathering passive surveillance data across the country. So passive surveillance is, again, mostly administered at the provincial level, which means the data sets, the protocols, the procedures from province to province are quite different. And that can be very difficult to get a national perspective on what's going on when different provinces do different things. And so with eTick, we're able to, or at least we're using the same process and procedures across the country. How does it work? Well, it works very simply. What it means here is that it works the same as most other citizen science projects. So you find a tick, you remove the tick, you take a picture of it, then you submit the picture either on our website or on our mobile app, and then one of our team member will get a notification. So this happens instantaneously. And then during, within one business day, what we call our regional expert or regional administrators will identify the tick, and then two things will happen. First, you will get an email with information about the species. Where can it be found? Could it potentially be a carrier for different pathogens? And again, this depends on the species, the province of residence, and then some resources as to what should you do or what is proposed by the provincial health agency. We also provide information of veterinary relevance. At the same time as you receive that email, a dot also appears on our map. And so the distribution points for all of the valid submissions, by valid, I mean submissions with a good enough picture that we could provide an unambiguous identification, appears on our map in real time. And so if you visit our map today, it will be different than what it looked like yesterday. And then if we do have time at the end of the session, I'll give you a little bit of a live demo so you can see what I mean and what you can do with the map and some of the public data that we have. So this here is just sort of a little bit of a recap of what I've said. So one of the advantages of eTick is that our regional administrators will usually, under ideal circumstances, take between 15 to 60 seconds to identify a submission and then click on the, let's say, Ixodes scapularis button, and then the person will receive the proper message for that species based on their province of residence. So it's quite fast. Of course, as I said, most procedures and exchanges are automated, but if there are issues, then we usually communicate with people. So it's not like you're just talking to a machine. There are real people behind this. And I also want to say that at this point, the ticks are not identified by artificial intelligence. These are real people looking at the pictures and taking into account not just the image, but also the rest of the data to make sure your submission is adequate. The submissions, as you'll see, can be filtered, so you can play with the data. All of our data points are public, so you can see the pictures, the species, the date, and the locality for each of these submissions. And we can also, we share the data, of course, in aggregate form with our partners and colleagues. So we'll talk about here the distribution and the phenology that can be monitored in near real time. As I said, the map is updated every minute of the day. And so we can see, for example, every spring where the first dots appear, where they are, or in instances when we get, well, not, I wouldn't say strange, but rare or uncommon species. If we start seeing a lot of them, it allows us to notice again in real time. Some of you might be familiar with other crowdsourcing platforms like iNaturalist, for example, and wondering why we would bother developing something like eTick. So, well, we developed eTick quite a while ago, and I am a big fan of iNaturalist. So here, this is not a question of competition. We are very different. iNaturalist, of course, will possibly give you an identification. It may not be ideal. It will be an identification provided usually by other people in your area. However, with eTick, your identifications will be provided by someone that has been trained specifically for image-based identification of ticks. Now, We also provide instructions as how to take a good picture. But I'd say, in my own opinion, what makes eTick very different from iNaturalist is the information that we return to the users. So we don't provide just a name. We actually provide information that has been drafted and updated on a regular basis with the different groups of provincial health representatives that work with us. And so the messages from New Brunswick will be different than those from Saskatchewan. And we revise those messages based on new information or new procedures. So here, I'd say that this is really what makes eTick different from iNaturalist, is that we provide more than a dot. So it's not just a way for us to collect information. I'd say the added value, or at least to me, even the main advantage, is the information we manage to disseminate through the platform. So I've already hinted at the fact that we've started this project a while back. So 2014 is when I pitched the idea, and it was received with a bit of a smirk and a smile, and everyone says, bah, no way, we can do image-based identification with ticks. It's never gonna work. But I figured if we can do it with butterflies and birds, cell phones are getting so much better. Why not at least giving it a shot, which is what we did. So we had a team composed of various people from FAC and the Laboratoire de Santé Publique in Quebec, and we developed a proof of concept as well as I'd say a eTick 1.0 platform. And we were able to demonstrate that, yes, we can identify ticks with high accuracy, and that our platform was fairly easy to navigate, even by people with very little experience. It did evolve. So I just realized now that it's been 7 years since we began. And so in 2017, we put in an application for the Infectious Disease and Climate Change Fund, which was successful. And so we have managed since 2018 to get, I'd say, the means to go from a basement amateur project to something that does look a lot better and with much better resources. And what is most visible, at least to people looking at the computer, is that first we've expanded the service outside of Quebec. We did that gradually, and I'll explain why in a bit. But we also built a brand new digital infrastructure, so improving the user experience as well as a number of other things. And so this is what we've currently been working on. So talking about this progress, how we've unfolded beyond Quebec, as you can see here, we went quite gradual. So the first year we added in Ontario, New Brunswick. Last year, we were able to add a few additional provinces. And just this year, in 2021, we managed to cover and fold in all the remaining provinces. We are still in discussions with the territories, and hopefully we'll be able to add those also by the end of this year. The reason why we did this in phases is because, as I was mentioning, we draft all of the information for every species in collaboration with local public health authorities. This means a lot of toggling, a lot of negotiation, a lot of revisit, and a lot of coordination. And so every team works differently, and we had to adjust and adapt. So this is why we went one province at a time, because eTick it was never our intention to take over in a province and do whatever we wanted. So this is really something that can only exist with the collaboration of the local public health authorities. So let's talk about progress just quickly. So this is what our homepage looks like now. I'm pretty happy with it. It looks pretty good. So this was progress from 2019. But before it did look like this, it was kind of looking like that. So you can see our original homepage was a little, well, 2015. So it does count, even though it worked more or less the same way as today. The navigation experience is important. So we're quite happy we were able to revamp the look of our website entirely in 2019. And then in 2020, we were able to release the eTick application on both the Google Play Store and the App Store. Now, I'd say this has been challenging and really an extremely large amount of work, but definitely worth it. We've had here, that number is a bit obsolete. It's probably closer to 40,000 downloads by now. But since we launched in April 2020, the app has been downloaded many, many times. And we now realize that more than half of the eTick submissions come from mobile. So there has been an important shift in the way people do things. 2014, the computer still had an important part, but now I'm expecting the share or the proportion of people submitting through or directly on a computer will constantly diminish as the proportion of people that submit through mobile will increase. That comes with its challenges. Anyone here familiar with app development and maintenance will know that it is a complex task. We do our best, but we do have bugs on occasion. So what about the data? So again, here, I just want to take you through a sort of a general uptake of what we've done. So the first year when we expanded beyond Quebec, so 2019, you can see here we have Ontario, Quebec, New Brunswick. By the end of the first year, we had close to 1,400 submissions. 2020, we had a massive increase in submissions. So not only did we expand and add provinces, so we did add Newfoundland, we had Nova Scotia, which is quite tick heavy, as some of you might know. Saskatchewan in 2020 was a huge success, instant success. I'd say even on the first day, we had dozens of submissions, and it was very busy all through the spring peak. So last year, at the end of the season, we were very happy with ourselves, close to 7,000 submissions. This was a huge increase from the previous year. But if we now move on to this year, even though we're only halfway through the year, well, things are even busier. So we've already gone beyond the total number of submissions we had for last year. Granted, most of the peak is in the spring, but still we are at this point in time, if we compare date for date, we have close to twice as many submissions this year than we did last year. So as you can see, we're now available from coast to coast, which is good news. And there are fewer points. This is only the 2019 data starting January 1st to January 7th, but it gives you a bit of an idea of where people who submitted ticks did come in contact with them. So now I'll start looking at the trends, and I apologize for the French on some of these figures. I had to extract them from another presentation, and I didn't really have time to update the text, but you'll basically be able to see that the trends don't change regardless of language. So I want to look at last year's data primarily because it was the first year, well, full year, where we had a good amount of information. So for the entire season, we had close to 7,000 submissions. So it's interesting for us to look at what did we get for last year. So this is pretty standard for ticks. A big peak in the spring, a second peak in the fall. But of course, as you'll see in a bit, different provinces have very different profile. And even though here I'm providing a summary by province, it's important to keep in mind that every province does not really fit exactly what I'll say here. And I'll give you an example in a bit. But what's important to see here is that in early 2020, so last year, right at the beginning of the COVID pandemic, Ontario and Saskatchewan really made up for the bulk of submissions. So red is Ontario, gray Saskatchewan. And we can see that the other 4 provinces made up for I wouldn't say marginal, but a smaller amount of submissions. So most of the action was in these provinces. If we look in the fall, though, you can see that Saskatchewan's fallen off the radar. Mostly because they have primarily Dermacentor ticks, and these tend to show up in very low numbers in the fall. So different trends, but again, keep in mind that this is a global profile and that it changes per province. Here I wanted to take a few seconds to show you that if we compare the same time periods between last year and this year, we see slightly different things. And this is where I want to insist on the fact that we are a young surveillance program, and that whatever we see in a year is not a trend per se. It's really just an observation. It's going to take us several years before we can really start digging into data analysis. So here I'm just into descriptions. But what I want to show you here is that for the exact same time period between, so January 1st to June 7th, in the 2 years, we have slightly different things. Well, first off, twice as much data this year as last year, but just like in 2020, the biggest portion of the pie is taken up by Ontario. But the biggest change for this year compared to last year is the proportion of submissions and even the raw numbers for Saskatchewan. Saskatchewan had a very cold spring, and we still have to figure out, is it because it's a very low tick here in Saskatchewan, or is it because people know everything about ticks this year and they no longer need to use our services, although this is not the trend that we see in any of the other provinces. So again, important to keep in mind that what we see in a year does not mean we'll see the same thing the following year. How about the species? Again, just like the number of submissions, it varies by province. But if we look globally for 2020, we'll see the Dermacentor species. And here I just want to make a small or a short parenthesis to say that the different, well, we have 3 species of Dermacentor in Canada, and most provinces have 2 of them. Some of them have 3. They are extremely similar, and we need to look at them under a microscope to separate them. So on eTick, we've lumped the Dermacentor species together because it allows us to identify them. And for the specimens that we've requested, so in some provinces we have requested specimens, it appears that Dermacentor variabilis, so the American dog tick, is by far, I'd say like over 95% of all the Dermacentor specimens we've collected, regardless of the province. So, but just to be on the safe side, and because we cannot for sure determine them based on images, we lump these species together. The Ixodes species, on the other hand, we can do to species, and you can see that following Dermacentor, Ixodes scapularis is our second most abundant species, and it accounts for the vast majority of fall submissions, whereby Dermacentor is definitely more of a spring species. So here you can see a little bit of these trends. For those of you not familiar with the scientific names, Ixodes scapularis is the black-legged tick, and so the main vector of Lyme disease out east, whereby Dermacentor here can actually be a vector for a number of pathogens, but not Borrelia per se. Okay, so again, let's just sort of compare what we've gathered last year to this year in terms of species composition. And here we see something very interesting. Remember how I've mentioned that Saskatchewan submitted very few ticks this year, and Saskatchewan is our main contributor of Dermacentor ticks, at least for 2020. Regardless, this year, even if even if Saskatchewan did not have a lot of records for Dermacentor, this is by far the most common species. We're seeing a lot more specimens of Dermacentor, but proportionally, they also occupy a larger proportion of the pie. If we look at Ixodes scapularis, the numbers are actually fairly comparable. Again, here I'm looking at raw numbers for Ixodes scapularis. And so they do account for a smaller proportion, but we're still seeing comparable raw numbers. So definitely, again, different trends. And I want to say here that even though for 2021, I've included all provinces, the bulk of submissions still comes from Ontario, Nova Scotia, and Saskatchewan. So even here, even for the other provinces, for example, some of you might be wondering what's of Ixodes pacificus. Well, we do have them, but only a handful so far. So here we're still sort of comparing data for similar fauna in areas. So let's just talk about host types. So when people submit to eTick, they have to say where they found the tick. Was it found on a human, on an animal, or did they find it just in their backyard or on their clothing, for example? And here, the trends are very, very similar between last year and this year. At least we have one stable trend, and it's the fact that about 66% of submissions are from humans. So the rest of them is about, I seem to recall, 25% from animals and about 8% or a little bit more from other sources. So not attached to a host, but sort of free in the house, outside, or on vegetation. So definitely here something that we're seeing. So the vast majority, the majority of ticks are submitted from human hosts. And again, here, if we look at the ticks that, and here I want to look at the 2020 data only, but basically just to give you an idea of the proportion of species that we find on human hosts and the proportion of species that we find on animals. So for ticks that bit humans last year, and here I'm really just talking about last year because I want to take the whole season in perspective. Remember that Scapularis is often as or more abundant in the fall, whereby Dermacentor is more of a spring species. So I really wanted to compare or look at these trends just for 2020. But we can see that generally, when people submit a tick that bit a human, 70% or close to 70% of these submissions are actually the American dog tick, which is kind of funny, whereby on pets, it's a bit different. So here on pets, we have a much higher proportion of Ixodes scapularis being reported and fewer Dermacentor. So this is something interesting, and we're looking forward to be able to compare that data from 2020 with that of 2021 is see, especially now that this year we're in a high Dermacentor year, if those trends are stable or if they are different. But so far it appears that we find usually more Dermacentor than Ixodes scapularis on humans. Now, I want to bring your attention to these little pie sections that say other. So, of course, we don't have only 2 species of ticks in our country. Even though the bulk of submissions are Dermacentor and Ixodes scapularis, we do get other ticks, and we are interested in the monitoring of all tick species, so not just the black-legged tick. So what are these others? Well, several species of Ixodes. This year we were happy. We got our first Ixodes pacificus because we rolled out BC only this year. But the other species that you see here, Ixodes marxi, Ixodes cookii, the marmot tick, is one that we actually see quite a bit in Quebec, but not in some of even the adjacent provinces. So these tend to be sporadic and rather rare submissions, but we're always happy to see a little bit more diversity, interesting things about hosts. For example, we even get ticks off of an escaped ferret once. So just to give you an idea of the kind of submissions that we get. So of course, if we leave the Ixodes aside, we have other ticks that most of you are probably familiar with. So Hemophysalis and Rhipicephalus ticks, which come every now and then. And then, of course, the amblyomas, not so much maculatum. This one is rare, even though we still get it on occasion. Some of you might be familiar with the Lone Star tick, so Amblyoma americanum. We get it sporadically. It is not appeared to be established yet, even though we know it's found in high density in certain areas that are getting closer to the border, but still no indications that that one is settled in Canada. But we do get several dozens every year, mostly from people that have traveled, but sometimes just because they can get carried by birds and other traveling animals. So we're keeping an eye on this Lone Star tick on a periodical basis. Again, as I said, we can follow these informations in real time. So this is one that we're looking for. Of course, we're also looking for the Asian longhorn tick, for example. So we do keep an eye for potential newcomers. So remember, I've already mentioned that every province is unique, and I want to take a few minutes to show you how true that is. And I'll take my own province as an example. So remember here, this is the 2020 data, the global 2020 data with lots of Dermacentors and then some scapularis in the spring and in the fall. But if we look at the same sort of display for Quebec, and again, just the 2020 data, we have a very different picture. So here, Dermacentor doesn't even show up. It gets folded into the others. And unfortunately, we see a lot of red. So Ixodes scapularis in 2020 made up for over 80% of all tick submissions in Quebec. So a much higher proportion than compared to the national proportion. Our second most important species was Ixodes cookii, so the marmot tick. Again, much more abundant. Here's sort of a spring, well, late spring, summer species. And Quebec is the champion, I'd say, of Ixodes cookii. We do get more submissions, at least proportionally, than any of the other provinces. So again, I just wanted to take the time to show you, I don't have time to decompose the data like this for every single province, but keep in mind that every province has its own profile, even adjacent ones. So briefly, for example, Quebec and New Brunswick, we have a very, very similar profile. Ontario and Nova Scotia tend to have similar profiles. So again, some interesting information there. So I'm going to wrap up the presentation before we get into a short demo by just talking about some of the challenges that we've experienced trying to develop, improve, and roll out the eTick platform. And I'd say that there has been several issues. So on the left, these are mostly things that we figured out as we went along. So for example, some of the terminology we were using wasn't well understood by the public. For example, when we say, was the tick attached? Well, for us, it was obvious, but it's not necessarily obvious for people. So we had to provide explanations as how to take pictures. So if you only take a picture of the ventral side of the tick, we will probably not be able to provide a species level identification. And then outreach. So how to increase visibility, how to make people know we exist. This has been challenging because as we were rolling out, sometimes it would be hard for us to be recognized in the province. But the neighboring province, we would get emails of angry people wondering why we were not available there. And so it was a bit of a balancing act here, trying to explain why we could not offer our services all across the country in one shot, while still at the same time trying to increase our visibility. Now, now that we're coast to coast, it's okay, but we really still struggle with this. For example, as I was telling Jillian before we started, there's a feature running on the weather network right now. So since last night, we have reached peaks of traffic that we've never had in the past, and that's causing the site to be glitchy. So obviously some issues, but we're still learning how to cope with our newfound popularity, I would say. On the other side, I'm looking more at some of the things we had anticipated and that we've managed to work with. So finding collaboration in the provinces has been, I wouldn't say challenging, but we needed to find the right people willing to take their time. And then COVID hit. And so trying to get people that were running everywhere, dealing with COVID, to still give us a review on a message or something like that has been quite a challenge. And I really, really want to thank everyone that has done their part here, because it was a difficult time, and it still is in a sense. Making sure that the messages we disseminate are aligned with both the public health professionals, as well as some of the academics, and also up to date. So sometimes we had to change and modify when information changes. Maintaining the mobile app, I'd say globally, is our biggest challenge. It's expensive, it's resource intensive, but it's our biggest gateway to submission. So it's something we have to do, but I have to admit that it is more challenging than what we had expected. So what's next? Well, we're hoping that we'll be able to have the territories join in. We are negotiation. Well, I shouldn't call it negotiations because it's never a negotiation. We're trying to complete discussions with the Northwest Territories. So hopefully we'll be able to complete them by the end of this year. And then the remaining territories we're really hoping to cover by the end of this year. We are hitting the end of our current funding cycle. So right now we're in discussions with various partners as to how can we maintain and even improve the eTick services in the future, because we've demonstrated that it's a well-used resource and that it does fill a need. So we're really hoping that this is something we can do. Before I take 2 or 3 minutes to give you a bit of a live demo, I really just want to acknowledge everyone that's participated, helped us, supported us. And here I could not put all the names. I've gone for logos and a number of academic partners here, but all the identification people, all the institutions, the PH reps, all of that. Thank you very much, because this would not happen without you. So before I move on, or if I move on to the live demo, which I can or cannot do, I guess it depends on Jillian. Maybe you want to let me know what would be preferable.
Yeah, I think we have time for the live demo. That'd be very
Okay.
interesting for people to see.
And just as a word of caution, as I was mentioning, the weather network traffic has been creating a little bit of complexity for us. Sorry, I have to stop sharing for a second while I open it. And I really do hope that we are in a relatively low traffic time period, because as I've mentioned, we've been encountering some challenges. So I told Jillian that it is possible that the live demo may not work, but it does. Woohoo! Okay, hopefully this will go well. I'm just going to make it easier for me. All right, so basically here, when you get to our homepage, and again, things will be loading slowly because when I broadcast, it's a bit slower than if you were on your own computer. So this is our homepage. And basically what I want to show you today is not really how to submit a tick. This is very easy. We tell you how to do it. It's two things. The first one is what's called public data. And under that area here, what you get is basically every single valid submission that has been submitted to eTick. And what is interesting here is that we give you at the top a breakdown by host type, but you can filter all of that information by year, by species, by province, by host type. And then you can also do that for a specific set of dates. And so if you're wondering, I'm wondering how many submissions there has been in British Columbia, for example. Well, since we've launched about 3 weeks ago, we've now reached 106. So that gives you an idea. On the other hand, if we want to see how many submissions for Ontario since we've launched, again, remember, Ontario's been part of the project for a longer time period, we're close to 9,000. So again, this is a very useful feature for someone trying to get numbers for a specific area, a time period, or just a general idea. Another feature is the map. And the map will take ages to load because of my institutional firewall and also because we're broadcasting. But while it does, I also want to mention that just like the public data, basically those 18,000 points that we saw in the public data, well, these points are basically displayed on this map. Well, they will be in a few seconds. This information can be filtered the same way as we filtered previously. So for example, if I want to see what's happening for Quebec, or let's say again, well, yeah, we could try that. So let's apply here for Quebec. And then there's something I'll be able to demonstrate. I knew this was going to be slow, so I apologize. It should be faster on your own device at all times. So this won't be long. Again, it needs to reboot because it's thinking. We're getting there. Okay, so we have all of the Quebec dots here since the beginning of the project. And so what you can do and say, oh, I'm wondering what's going on in my area. So I live in Sherbrooke. You can see that I kind of live in tick country, and you can hover your cursor and look at every dot here and see the species and the images for that submission, as well as the date and where it was found. And you can do this with every single point on the map. And you can filter, again, as I said, by province, but you could also decide to filter by species so that you would get all the dots for the black-legged tick, for example. So these are the two main features that I wanted to show you because they're interesting for visitors, not just for people that want to submit. The submission process is pretty easy, very simple. It can sometimes, depending on the device you're using, it can be tricky, but it's rare. I'd say, 1 out of 1,000 submission as an issue. But if you do ever encounter one, I suggest you use the website. It's actually easier to navigate. Well, not easier to navigate, but it tends to be less glitchy than the apps. I'm going to stop here because I realize that we're running late, and I'd rather take some questions than just show you things that you're capable of doing on your own.
Oh, thank you so much, Dr. Savage. That was so interesting. It's a really neat platform. I will just share my screen here. All right, so it's time for questions. So just as a reminder that you can type your questions into our Q&A box below, and then we'll read them out. Yeah, so we'll just see if we've got any here. Oh dear. All right, well, while people to think of their questions and ask them, I can get us started and ask one. I think this citizen-based surveillance project is so interesting and seems to contribute something that might be very difficult for scientists to go do, a tick drag where you get 8,000 ticks all across Canada. So you just speak more to the citizen-based surveillance and what it can add to the science that maybe would be tougher to do in a traditional scientific setting?
Well, as I said, I mean, we still need people to go out and drag, so we're really looking here at more of what I call the passive surveillance approach. It does, of course, increase the how could I say this? The space that we can cover. So for getting an idea of where do people come in contact with ticks, this is a great way to do it because it gives people an even chance of having their dot on the map, regardless of what province they're in. So it's the same submission way. However, so this is one part. It also prevents the implication or the necessary implication of a third party, like, for example, a doctor or a pharmacist. So in some provinces, you need a vet or a doctor or a pharmacist in order to get an identification on your tick. So it does cut this part. And again, here I'm looking at it more from the point of view of the citizens than the point of view of scientists trying to get data, because there is some existing data. There has been passive surveillance in the past. There's some really good data out there. We're just building on what's been done before and making it easier for people to contribute. But, well, not but, and it does provide information that can inform active surveillance. Again, because it's available in real time, we can see things happening without having to wait until we write a report at the end of the season. And so this is an interesting thing, and we can then work with some of our partners that will decide to go and do active surveillance and use the eTick data to maybe decide where or when they should be going to do some tick drags.
Well, it's really interesting. It's neat that they can both come together and both be very useful. We've got our first question here in the question answer. So asking, should every tick be added to the system or just one per location?
Okay, so let's say your dog has 50 ticks on it. I'm not wishing that on anyone. You cannot submit multiple ticks in one picture. The reason being that it could be mixed. So sometimes we do see Ixodes and Dermacentor on the same host. Also, if you have many ticks on the same image, often we're unable to provide even, the quality is not good enough. And so what we normally would ask people to do would be to take a subsample of those several ticks. It's not ideal because it gives us locality information. It does not necessarily inform density, but what we want to avoid is 50 submissions from the same host, so that people would think, oh my God, this place is crawling with ticks, but it's not. It's actually one dog crawling with ticks. So we will not accept submissions with multiple ticks, and we'll usually recommend that people submit just a really small subsample, no more than 5 of these. So we tend to have few repetitions. That being said, there's always a few keeners, I call them, who have lots of animals and will tend to submit repeatedly, not from the same animals, not from the same day, but from the same location. It does happen, but it's actually not so common. So the number of submission per user is very low. Most people submit only once or twice, with a handful of users submitting quite often. And here I'm excluding veterinary clinics because we're different. This is different kind of information.
Good. Okay, we've got another question here. Do you anticipate eTick fatigue, which you touched on briefly, where people have the information they need and no longer feel they need to submit a tick? And can you draw conclusions from the other citizen science-based forums on this?
It's possible. And this is something we'll investigate in the future. At the moment, obviously not. I think one of the differences between eTick and some of the other citizen science-based forums is that our submitters are not naturalists. They're not people with an interest in wildlife. They're not people with an interest in tick monitoring. They're people with an interest about what to do. I found a tick on my kid. And so I think we have a very different type of participants than some of the other initiatives, like, for example, eButterfly or eBird. Although looking at them, they're so popular that there is some fatigue going on, but I would not expect that we would encounter the exact same problem. That being said, though, the more information we disseminate and the more people know about ticks, I would assume that going through years, I would expect the number of submissions to decrease, because people will know what to do, will know what the ticks are, and will have learned to recognize them. And if that happens, well, I'll consider a good part of my job done. So that's something that I do not necessarily see as negative.
Good. I think all of us in health are trying to work ourselves out of a job.
Well, I do have a job.
Okay, got another question here. As some people who work in outdoor professions, so like working in parks or forestry, have more exposure to ticks in their workplace. And have you worked with any of these professions to have them submitting to eTick?
We try to reach out by group. So for example, we've had some of our team members trying to figure out associations. So for example, hikers groups, or as you said, city workers, outdoors workers, different target groups. Yes, So it's not always easy to find the best gateway to reach out to these people. We found that social media is actually often our best way to reach out. So we've tried to do targeted posts. We try to increase our exposure on sites, forums, especially some of these, for example, when you have, and here I'm going to have to say it in French, but the salon chasse et pêche, so hunting, events, these kinds. So we try to make ourselves visible into these public events. So again, outside of the sphere of public health, but mostly for end users. And we still try to improve that. We've been quite visible this year. I'd say we've also received some invitations from different, so for example, invitations to work with Scouts Canada, invitations to give talks to the City of Montreal. So we usually try to be present and share the information as much as possible. But we do not have specific, I'd say, again, sorry, my French brain is on. We don't have specific des ententes or anything special with some of these potentially groups that could use eTick more.
Sorry, we've got a question here. Could you expand on the limitations that are present due to not differentiating between the Dermacentor species? For example, are there potential difference in pathogens carried and therefore different risks posed by these species?
Well, yes. So for example, Dermacentor albopictus is found mostly on moose, large ungulates. We hardly ever see it. And I know that because we do request specimens of Dermacentor, not all of them, because there would be thousands, but we do request them regularly to see what species we're dealing with. So here, Dermacentor albopictus, for example, this winter tick, does not have any pathogens that could be of medical relevance for humans, and it hardly ever is found on humans. As for Dermacentor andersoni, it could be a problem. It is a vector, for example, for Rocky Mountain spotted fever. And so we do provide that information. So one thing I want to say is that when people find a Dermacentor tick, depending on their province, we provide information about all species separately. And so we say it's one of these species. Depending on your province, it's most likely to be either variabilis or andersoni, because albopictus is rare all across. And here's the information relevant to these species. And here's what you should check for in case you develop symptoms. So we are aware of that limitation, and therefore we disseminate messages for all the, separate messages for the different species so that people get that information, so it doesn't get lost.
Great. I think we just have time for one last question here. So asks, am I to understand correctly that it only takes 30 to 60 seconds for a submitter to be told what type of tick they have submitted?
No. It takes us 30 to 60 seconds to process a submission. But for example, this morning I got up and I had 300 submissions. So I cannot do 300 submissions in 30 seconds. But again, I do not do all the submissions for the country. So we do have teams. We require, or we mention, 1 business day. Different teams work at different speeds. Some teams do not work on weekends. Some do. So sometimes you might get an answer within 20 minutes, but it could take up to a full business day. Yeah, we would need some serious AI to be able to turn this over in 30 to 60 seconds. Hopefully we'll get there eventually.
Yeah, well, you've made so much progress since 2014. It's very impressive.
We have.
Yeah. Well, I think that's all the time we have for today. So I just want to thank you so much, Dr. Savage, for joining us and sharing this eTick platform. It's been so interesting to learn about it, and to thank all of our attendees for joining us today. Just a friendly reminder that once you close the webinar, you'll be redirected to our quick post-evaluation survey. So we'd really appreciate if you could fill that in. Just give us some feedback on how we can make these better as we go forward. So thank you very much, everyone. Have a good afternoon and stay safe.
Thank you, everyone.